You're good to go.
Good afternoon. Welcome everyone to the Jefferson County Health Department Board of Trustees meeting. It is May 22nd, 2025. It is roughly 4 p.m. by all the good clocks. I will call this meeting to order. Ms. Pinkley, would you please do a roll call?
Mr. Pig,
I am here.
Dr. Henry,
Here.
Ms. Stidham,
Here.
Mr. Deal, and Ms. Taylor.
Here.
Mr. Deal should be arriving late, but he's absent right now. Ms. Henry, would you please read the mission, vision, and purpose, please?
Sure. Mission, promote positive health outcomes through the delivery of foundational public health services. Vision is a healthy Jefferson County. And the purpose of the health center is the JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. Appreciate that. We're gonna hold the door ajar a little bit, try to leave it open, but cut down some of the noise. Two things same time. All right. So next on our agenda is approval of the agenda or amendments thereof. Does anybody have any amended? Yeah, I'm sorry. pardon me.
Apparently I'm having some audio issues. There's nothing coming through, so I just want to make sure. Sorry, I don't mean to do that. Hey, you don't have any audio? You can't hear any of it?
Sorry, everybody's getting really close up of me.
Great. I think I figured it out. So sorry. Thank you. Bye. I'm really sorry. You're good to go. I had somebody else confirm.
Okay, so we had some audio issues, which we had last time as well. So we're trying to get all those lined up. The new building, when we get over there, we'll definitely have that fixed, correct, Mr. Perry? Yes. So we did have the roll call. Everything was good. We did read the mission, vision, values, values and purpose. And now we're to the approval or amendment of the agenda. Are there any amendments? Not hearing any, do I have a first for approval of the agenda?
A motion for approval of the agenda.
Do I have a second?
Second.
Having a first and second, is there any discussion on the motion? Not hearing any, all in favor, please say aye. Any opposed? Motion carries. Welcome guests. I know we have two here today for sure, so welcome here. We'll get you on section 7 down the road. On the next agenda, so we have approval of the March 27, 2025 meeting minutes. Do I have a motion?
I'll make the motion to approve the March 27, 2025 meeting minutes. I second it.
Having a first and second, is there any discussion on the matter?
I would just like to thank them for being updated. Thank you.
Gary, thank you, and thank you for that patience on that. Any other comments? All right, not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is approval of the April 24, 2025 meeting minutes. Do I have a first?
I make the motion.
Do I have a second?
Second.
Having a first and second for approval, is there any discussion on the matter? Not hearing any, all in favor of approving the April 24th, 2025 meeting minutes, please say aye. Any opposed? Motion carries. Next is the approval of the April 2025 expenditures, and that amount is for $91,452.19.
I make the motion to approve.
First, we have a second.
I second it.
And then a first and second. Is there any discussion on the matter?
Some couple.
The Fluent Stream monthly telephone service, is that something new? I don't remember seeing that before.
It's not new, it was paid electronically prior.
So what is that for telephones? Cause we have an AT&T bill too, that's like 3,000.
It's for the internal phones, not cell phones. It's like the telephone system.
Is that
So
the
does
board?
everybody have two phones then?
No, not everybody has two phones. Usually supervisor or managerial, anything that's salary that needs to work outside of hours would have a cell phone, and that's the AT&T portion you're seeing. But we do all have office phones as well.
Oh, and is that like handheld ones?
Yeah,
They're,
like a desk phone, yes.
they're desk phones.
Yes.
That seems like a lot. I mean, $7,000 a month they're spending on communication per phone. Monthly.
They're voice over IP, correct?
Correct.
I mean, we can look in, I mean, I'm sure you do that on a,
It is something on my list to go out for bid for phones in the future. We're just trying to get through the new building.
Oh, okay.
But
That's
that,
I don't remember seeing that.
that also includes Wi-Fi's, correct, for when we're out in the community?
The AT&T, correct.
And then my other question on the elevator fees, I didn't see it last month, so I didn't bring it up. I saw it again. I'm guessing that service is for the Arnold
Correct.
elevator. Is that like code that we have to have it inspected every month?
Well, it's not inspected, there's
Service?
service, yeah.
It's service. So they come out and check it to make sure everything is operating properly.
let's go, have expect at least year yet.
You have to have yearly inspection because you have to, the state has to give you a
License.
commercial license permit to operate. That's one good thing about the new building that I'm kind of glad we will not have an elevator because they are a headache.
Is there like a contract with them then? And they come out every month? It's not required that we have them every month, right?
Yeah, actually, it's not required, but it's advised because prior to them, we didn't have any maintenance, and we would have breakdowns.
So elevators are notorious for being
Right.
high maintenance devices, they just are.
Do we have like how much we've paid in repairs to that elevator in the past year? Cause I mean, if we're paying them $370 a month just to come out and look at it. Every
Not
month.
just looking at it, they're going over the equipment and doing, if there's lubrication or if there's something that needs to be attended to, they are checking it and do. Well, it's our handicap. So it's part of our handicap entrance for that building, so all of our handicap parking in that building. Unfortunately, is at the back of the building, so if people use the back of the building to come in, they have to come up that elevator to come in for services.
And Windstream, is that our internet?
Correct.
Okay, thank you.
Any other questions or discussion points? So we have a first and second motion for approval of the April 2025 expenditures. Are there any other questions? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is approval of the April 2025 electronic payments for $536,953.64. Do I have a motion?
I make a motion that we approve electronic payments.
Do I have a second?
I'll second that.
We have a first and second. Is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is pre-approval of the June 2025 electronic payments for $648,276.00. Do I have a motion, please?
I'll make a motion to approve the pre-approval electronic payments for June 25.
Second.
Having a first and second. Is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carried. Mr. Sykes, you're up.
Okay, not a whole lot has changed on our grants and contracts. We did get a word from our Title 10 funding that they secured 3 months of funding. Missouri Foundation for Health gave us some funding to hold us for the next 3 months. So as we wait to see what happens to the actual Title 10 on the federal end. The other grants, contracts were pretty much where they were at last board meeting. We received a program support grant from the Jefferson Foundation for $175,000. I want to thank Katie Delmodek for her work on this grant. That really helps our clinical services. So it was, that was very appreciative. Also, we had a meeting with Department of Health and Senior Services. They put on a monthly chat with all the counties, and they discussed some of the funding with the state, and I included that a graph, a chart in your. It looks like what they're going to present to the governor, that we're gonna get a lot of our funding restored. Actually, it looks like that our core revenue is gonna go back to where it was prior to COVID with our core. It kind of dropped during COVID. So it looks, that's, with all the cuts that we have seen, that's some good news. This isn't a major part of our budget, but it is a significant amount of money that could come to us if the governor does sign that. So that was welcome news. A couple other acknowledgements I want to give out. We had some of our environmental public health specialists pass the Missouri Board certification for environmental health specialists. Supervisor Dan Kane, Jennifer Heister, Victoria Bowen, and I forgot to put her on here, Julie Plaster. I'm sorry for that. They all passed their exam. So our department, environmental department, of the 9 staff, 7 of those are certified either through the state or nationally. And the 2 that are not eligible yet, because I think they have to have 2 years experience, I believe that's what it is. So once they get that experience, they'll be able to take that exam. So that's pretty significant to have a full staff like that. So congratulations to them. Several of us went to the NACCHO conference, and the couple of reasons. One, it's a very good conference, but the other, we had some presenters there. Gina and Anne Marie did an outstanding presentation it was attended by several agencies across the country that were at this, and they enjoyed that presentation. They did a good job. And also, Gina and Anne Marie, I think I spoke on this at a past board meeting. We were recognized for a PPHR certification. And I believe we are the only county in the state of Missouri with that certification. So, and then finally, I want to recognize Miss Molly Fox. She is here. Miss Molly is going to retire. I was hoping Dennis would be here by now, but you were here before Dennis probably was, weren't you? So, well, actually, after Jeannie retired, 40-something years working here, you probably had the next longest still on staff. So Molly has worked with us for 31 years. And prior to that, you were with St. Louis County. I always forget county or city.
With the county for 4 years.
So 35 years in public health and all of that in environmental health. So we wanted to recognize her. She's going to be leaving us on June the 3rd. And we got a little certificate for you and a little letter we want to give you. No, it's not much, 35. You want to do what?
Can you just do that over here real quick so I can grab a photo? The photo, I know, sorry, annoying.
I'm sorry. Oh,
We should have worn a dress.
what do you want us to do? This man?
That was fun. Yeah. Don't worry, you guys are good.
Thank you so much.
I smiled so long. Thank you very much.
I got to say things twice now. Oh, I'll just make this brief. I mean, yeah, I came here from St. Louis County because in St. Louis County, all they do is restaurant inspections and it gets kind of old after a while. So I wanted to come out here because, they do all kinds of things in environmental that might not sound real neat to some people, but looking at sewage, looking at lagoons, finding where the problems are, doing lead risk assessments. I mean, when I first came out here, we did task force inspections with the building department and the Division of Family Services, and we would go into hoarders' homes. So things were a lot more exciting out here. And anyway, it's been a good place to work. I guess I would have hung around for 31 years.
You must like it here.
Yeah, I did.
Well,
It's
thank you
been
for your
fun.
service and patience with us.
You're welcome. It's been a fun place to work.
And enjoy retirement.
Yeah, yes. Thank you very much.
Right.
Thank you. And that's my report.
Nothing else in your. So next inside here is the discussion as requested by Ms. Brown. Ever. At the last meeting, so. Ms. Brown?
Do I need to stand or not?
Okay.
I just want to speak briefly as possible on the importance of infectious disease control. Hopefully I'm talking loud enough. I'm the hearing aid in one ear, so I'm trying to talk as loud as I can, but I want to hear myself talking. So the goal of public health policies is to improve health outcomes and accountability of policy makers. It's also important in evaluating the effect of policies on health because health professionals want to know that the policies they put in place have or had desired outcomes on health compared to what would have happened if not a particular policy was not made. We don't have time machines, so we have models of disease transmission, and they're developed to simulate the alternative reality of a particular situation or case. They give you some baseline on the expectations of what would have happened without the policy. They also give them a look at outcomes in terms of health metrics, being the number of infections, cases, hospitalizations, or deaths, but not policy considerations. That's totally different. Meaning the social and economic impact of policy could have on other policies already in place. So I would like to believe that everyone believes that healthcare matters, public health matters to all of us, and it makes a difference in all communities. So I believe medical research is vital, with many medical researches going on in universities, health agencies, hospital research centers who study disease, organisms, and illnesses. They also research, test, and develop vaccines. Research, I believe, is important to the health and welfare of a total population, meaning communities, schools, workplaces, here and globally. There should not be a question about the seriousness of infectious disease and control as it affects the planet and humanity in general. We don't know what we will face in the future as it relates to susceptibility to new infectious diseases because they are coming. I am by no means an expert in infectious diseases, although my healthcare credentials are BS in healthcare administration and management. My certifications include infectious disease transmission, models, and policy decisions. Also communicating during global emergencies and response with case studies, as well as contact tracing earned through Johns Hopkins Emory University, and Bloomberg School of Public Health. I subteach children with autism on many levels, medically, compromised, and some with behavioral and developmental disabilities. We worked through the whole pandemic. Some were vaccinated, some were not. We were scared, we were terrified. We followed disinfection protocol, distancing, etc. I have worked for the United Way in small administrative roles and non-medical caregiving and hospices in private settings. I take yearly school required courses that include bloodborne pathogen prevention, viruses, proper disinfection, confidentiality of records, harassment, and misconduct. So I believe our children's public health future and survival depend on health departments being able to respond to infectious disease threats through disease surveillance, ongoing collection, analysis, interpretation of data, monitoring, and response to transmitted diseases. Health departments investigate cases and outbreaks that provide health interventions. This controls the spread and reduces the risk of transmission. So I believe we must have the ability to respond to these particular threats in the future. Like I said, they are coming. It's imperative to work with providers, hospitals, labs, schools, and communities. And the two key elements to effectively fight against global infectious diseases are understanding the mechanisms underlying a viral transmission and contagion. The public adherence to control and preventive measures as well. That's important. Ideally, they should go hand in hand, but not always present at the same time. Infection diseases are illnesses caused by harmful pathogens or agents. They invade your body. The most common are viruses, bacteria, fungi, parasites, all causing infection through direct and indirect contact. They could be airborne and they could be through contaminated food and water. Educating the public on disease threats is critical for our future preparedness. And prevention strategies are necessary because there are many communicable diseases of public health significance. The impact of our public health is an increase in morbidity and mortality, global illness and death, straining healthcare systems and economies. We've seen overwhelmed systems, lack of beds, personnel, equipment shortages, especially vulnerable populations. So the long-term impact is increased economic loss, social disruptions. The social impact and disruptions in daily life, school, workplace, the closures, restrictions, and public gatherings that creates fear, stigma, and discrimination. So emerging infectious diseases through climate change, deforestation, data, analysis, and response all play a role. The pandemic was a test for governmental policy response and proved an unwanted real-time experiment. Underestimated the mutations complicating the mitigation and the containment. So basically, it was unknown and fast moving. It was not the first for humanity and will not be the last. There's no one size fits all policy. So I think investments in our healthcare systems and supportive networks are critical for all our preparedness, including public, professional, healthcare departments, everyone that would be schools, communities that would be involved. So thank you for letting me speak.
Any of the board members have any trustees have any questions? And quick thoughts? Okay. Thank you very much, Ms. Brown. Next on the agenda is public comments. I'm gonna ask that everybody please be civil to these comments. Would you please gather the cards for me, read in. Read them out when you come up, please state your name and your address, and we will hold on, don't start. So I can get this right or wrong. And yes, ready.
Lori Bourgeois. Hello, my name is Lori Bourgeois. I just wanted to bring up just a few things that seem to be coming up recently with the FDA and I don't have a lot to say just because we don't have all of the real specifics yet, but I guess my question to the health department would be, I had asked the last time I spoke, sorry. As these changes start to come along, is the health department gonna be willing to make the changes and pivot? If there's information that comes out from the CDC, because that seems to be what the health department stands behind as far as the gold standard. I'm sure you probably have already seen that the FDA, Dr. or Secretary McCary, Dr. McCary. There's new recommendations as far as the COVID vaccines and how they're affecting the age group 16 to 25 years of age. There's new warnings ordered by the FDA that add that the highest estimated incidence was in the males of this age. So like I said, a lot of this information has just come out in the past couple days. I will just read Andrew Nixon, who's a spokesperson for the Department of Health and Human Services, has stated Americans deserve radical transparency around the safety and efficacy of COVID vaccines, and the FDA is delivering on their promise to do just that. Moderna and Pfizer should take steps to ensure that individuals are aware of COVID vaccine-related adverse events resulting in myocarditis and pericarditis. The FDA says the warnings were spurred by new data from the agency's safety surveillance system and results published in October from scientists following up with people who developed COVID-19 vaccine-associated myocarditis. Scientists in that study followed up with people who had faced chest pain and elevated amounts of troponin in their blood, a protein that usually signals some kind of heart damage. They were predominantly young adolescent males. So I guess my concern is, as we move along with this, what is gonna be the protocol, of the health department employees? What are we gonna be putting out to the public as far as what warnings are we gonna be supplying to the individuals who are gonna be giving and continue to give these injections? There's also information coming out that they are changing the recommendations for COVID vaccines in general. Right now, they are recommended for 6 months and up. You can also look up this information. They have shared all of the other countries that are, similar to ours, such as Australia, Belgium, Canada, Denmark, Finland, France, Germany, the Netherlands, Norway, Sweden, Switzerland, and the UK. They are all recommending, like, their lowest is around 60. Most of them are 75, 80. I think Norway is the lowest one at 45 years old. And here we're still recommending to our children, our healthy children. So it looks like the recommendations are gonna be changed to they're gonna be changed to 65 plus unless someone has a high risk, which that whole thing is kind of all over the place too, as far as what's considered high risk. So I think, this information is gonna continue coming at us. And I just wanna know how our Jefferson County is going to address this and how we're going to help medical professionals to make people aware that they have the ability to opt out of this. There's so much talk about, myocarditis, and they're trying to say that, most of the time it resolves, similar to what the study described. The FDA's new warning also says that the heart MRI findings showed improvement over time in most people.
Thank you.
All right, thank you.
Can we make a comment on that?
Supposed to.
Oh, just not to, okay.
What, I.
We do
Why
have.
is that thing not working for me? No, I'm sorry.
Next is Liz Downer.
Thank you. I'm sorry, my phone's just, technology is being crazy. Okay, thank you.
Hello, Liz Downer from High Ridge. How are y'all today? I just kind of want to make a comment and about communication with since the Board of Trustees is an elected body, you will pretty much answer to Jefferson County residents, correct? So I ask a question regarding the infectious disease report. I don't know if you guys all got my email. I'd asked to forward that. And there was a communication back and forth between the custodian of records. And I wanted clarification on the agenda. If an agenda item is brought up, where does that, it has to be first and seconded, whatever. I don't understand where the history of that is. I did receive the YouTube video. And I do have the meeting minutes for that meeting. What kind of concerns me is it's listed under new business as future discussions. But that was decided by the chairman. It was decided by you to make that. There wasn't a vote at that meeting. That was 2 years ago, 2023, May 23rd, I think it was. So when we had this talk today, it was over 6 minutes. When we had Tammy want to bring up a discussion about vaccinations, I don't recall that meeting, but apparently there wasn't a second on it. So she got to stand up here like me, and she actually got 3 minutes to talk. She didn't get the 5 minutes it says. Okay, so she didn't have a report to submit or anything else, and neither did Valerie. But Valerie talked for 6 minutes and there wasn't a discussion. So I just think that the communication between the public, I mean, I don't know if the custodian of records wants to communicate with the public, pass that information on, I'm not really sure. But I just really think that when I have questions to ask about decisions that are made through the board, when you guys are elected people, I know you say we don't have to have these meetings, we don't have to have them publicly recorded or live streamed or whatever, I get that. But you are elected, therefore you are below us. You work for us, basically. So when I ask questions, I don't think I should be felt like I'm bothersome. You know, I mean, it's funny. It's really funny if I could forward these meeting minutes to you when the time when you guys weren't having public comments and I had about 8 questions. And so it was interesting. The meeting minutes were like all of my questions being answered when I couldn't ask them in public. And the whole not responding to us is a little like Tammy wants to make a comment. We can't. Why? Where is that rule? I mean, I think you gotta give us a little transparency on if you say we're up here talking and you can't respond to us, where is that documented? I haven't found it yet. And if you guys know it, I mean, maybe put it on your website.
I'll explain it to you real quick.
Okay, great.
It's against sunshine law. Because if you're bringing, right now, it's just about sunshine, so I'm gonna tell you, if you bring something up and we have a discussion that wasn't on the agenda, it's a violation of sunshine.
And for the counties on.
Yes, right here, right now. So if you bring something up, we cannot have discussions. That's why you're not supposed to. You can ask the attorney, she's sitting there. You can ask any attorney, because they'll tell you the same thing. If it's not on the agenda, they don't respond over there at the county either. And that's why, because it's not on the agenda. I know sometimes it gets aggravating, but that's sunshine. And we're following that.
All right, I think you guys hide behind that a little bit, but. That's okay, but, and town hall meetings, like, we haven't had a town hall meeting, and we were supposed to have one after this meeting, June 2023. And that one got canceled, and we haven't had one, and you guys, in this meeting. She specifically got up and said, we're gonna have 2 a year,
Thank you.
we have 0.
Is there anyone else? All right. Next on the agenda is the Negro building updates.
Okay, we're moving right along over there. Furniture installation is almost completed, which has really made the building look like an office. It looks so much different with the furniture installation. Still a few things left on that. We've got the wayfinding signs up, the door locks are now, I believe that's done now. They finally got the cores in, all the doors. Next week, we'll have our exterior building sign on the building and the monument sign out next to the street. I believe that's next week, right? Hopefully, if the weather holds out. They still are working on the punch list items from a while back that we came up with. They're working to correct those. The big project right now is they're putting down the asphalt on the parking lot. So that's a matter of dodging raindrops, I think is what's going on. However, they are there today. I think earlier they had almost, not quite half of the lot was paved. So I would say after today, and if they do work tomorrow and the weather is nice, it'll almost be done being paved. Then they have to stripe the lot. We still are waiting on landscaping. That's very weather dependent on that as well. So that moves me into my next item. We don't feel like we're gonna make our move-in date. So it's getting where I don't wanna keep the move-in dates. So why don't we just give ourselves enough time to make sure things are done? Plus, they still have to come in and do our occupancy permits, and that theoretically, the landscaping, everything should be done before they do that. So we still may be fighting the weather. So we put a tentative some dates to begin our move July 7th. And I know that seems like a long ways away, but we've got some holidays, there's still a lot going on. So we thought that would be enough time to allow to make sure the building is move-in ready. So I just wanted to run those dates by you all. The big the big issue maybe is that our dedication plaque that we voted on will have June. We probably won't have the dedication until July or August. But
The ribbon cutting then won't be on the 18th either. No, we'll change that.
I don't think, so. If we wanna, it depends on what we wanna do. We wanna just do a small celebration and do that and get it done and then have something bigger like an open house down the road. We can look at that model, but we were thinking about just pushing it off and doing it, but
I thought we put that to the public communications person to manage all that.
yeah, well.
She managed it.
Yes, why not? This weather's been in it has.
So if we push this back to July and give us a whole month, you know that the weather's gonna be perfect, and we're gonna get it done first week of June. And it's gonna be sitting there, but we still got a lot of stuff to move and we got a lot of, I think it'll work out better this way. And if anybody has any objection, we're gonna set that for a building. But really, it's coming along. I think we should see a completed building in June. Not April, but
We'll make sure we coordinate with everybody about date.
of the,
July.
of the trustees, make sure everybody's gonna be available, because I don't, I left out of that.
But probably one more board meeting here.
yeah, Christie brought that, we had said something about having our June board meeting over there, but yeah, if we don't have occupancy, we don't wanna do it, so June will still be in this building.
So we're gonna shoot for July with
That's,
snacks,
huh?
with snacks.
Yeah,
Anything else, sir?
no, it's,
Right. I lost my place. It's terrible. Nope. I've got to get there to the spots. All right, so next on the agenda is the second reading and approval of the resolution authorizing the Health Department, Health Center to provide mosquito control services to the cities of DeSoto, Hillsborough, and Kingswood. So, you know what? That's it. I had it. I'm sorry. I apologize. Give me 1 second while I get to that page. My board. And everybody else is already there. All right, here we go. So I'm gonna read this one time, and the city will be whichever city that I'll read them out. In each resolution, I'll go ahead and read the numbers of those city resolutions that would be attached to them. But I'm only gonna do this one time for all 3 cities, okay? So this is a resolution authorizing Jefferson County Health Center to provide mosquito control services to the city of DeSoto, and that number is 25-05-22-01. The next would be the city of Hillsborough. That number is 25-05-22-02. And the next one is Kimmswick, and that number is 25-05-22-03. Pursuant to the intergovernmental agreement wherein we will provide vector control for those cities. Do I have a motion?
so moved.
Do I have a second?
Second.
Having a first and second, discussion points, questions? Yes, ma'am.
In the last meeting, when this came up, I guess on the first read, I asked for, like a fact sheet, ingredients list of the chemicals in that. I haven't received one.
yeah, we have, you want it out? Yeah, that would.
So are we voting on this?
So you have an opportunity, please go through
Well, I don't know.
the list, you're right.
Well, a lot of these I'll need to look up, so,
Oh,
cause a lot of these I don't know what they are.
yeah. So this is approved by the EPA, correct? All this use?
Yeah.
Did we add Kimmswick or are they already on our list? So they're new, something we have. Hematite.
Excuse me, too,
I think we, yeah.
They were on
They
here.
were on there.
Okay.
from last year, all 3 of them.
On this first one, this permethrin.
Mhm.
Says it's a restricted use pesticide for crop and wide area applications. High toxicity of aquatic organisms.
So then it means it kills mosquitoes at a high level that have carry West Nile or other mosquito-borne illnesses. Infectious disease from mosquitoes.
They breed in the water,
Mhm.
that's what it's.
Especially stagnant, but it is.
Mhm.
My concern is just like, right here, like this first line. You know, the EPA is considered special sensitivity to infants and children to these pesticides. So my concern has always been, you know, when kids are outside and, I mean, when I was a kid, we used to chase those things.
Hmm.
You know, what's it doing to them? I mean, you know, chronic illness is a big thing right now. And, these kids are inhaling this aerosolized pesticide.
Well, I know there's criteria and a policy that they have when they're fogging.
Right, we do it at night when there's less activity going on. We follow the label very strictly.
Well, I believe that you do. It's
We
just
do,
that's what we're using, you know. I understand the risk of mosquitoes in West Nile and all. But I'm on the other side of it is how toxic is the chemicals that we're spraying to get the mosquitoes. And how it's inhaled. I mean, chronic illness in children is sky high. And this is a neurotoxin, probably inhaled in children, and that's why I'd asked for this beforehand, so I could do some research on it and be educated, knowledgeable on, you know, what the studies are, who's doing the studies, who's funding the studies. Say that it's safe.
Well, approximately worldwide, 2.4 million children die yearly from preventable diseases that could be cured with a vaccination. But that's the other side of that.
This is
So-
a vaccine, this is a
Yeah,
virus.
but the chemicals per se. And then the chemicals in our dirt, in our air, in our water, in our microplastics, there's just a whole array
Oh, I agree.
of stuff that.
Our
We're not going
environment's
to,
toxic.
yeah, we're not gonna stop any toxicity from ever being in the system, so.
You gotta start somewhere, right?
So we have a first and second on the floor. Is there any more discussion points? Not hearing, I'm gonna call for roll call, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
No.
Ms. Taylor,
Yes,
Motion does pass. Okay, let's see, the next one is request for the Jefferson County Council appointment, Steve Sykes as Jefferson County Health Officer. I need some assistance with this one.
So annually, the county council was supposed to appoint a county health officer. That is their authority and their decision to do that. Historically, they have looked to us and they have just always appointed whoever is our executive director. They did not do that this past January, it slipped through the cracks. So I reached out to the county councilor. They're happy to do it. They've asked us to draft the resolution and send it over for them to approve at the next board meeting. So as long as you don't have any objection to Steve being the county health officer, then I'll just go ahead and draft it based off what we've done in the past and send it over to them.
We don't need to vote on it, right?
I think of more of a health officer would be like our medical director, like a physician, an MD, somebody with a degree in medicine.
By statute, it doesn't have to be. It's typically whoever is head of your health department. And because we have a separate entity from the county, we have to do that in conjunction with them. But like in St. Louis County, it's the health department director.
Are they credentialed with medical?
I don't believe it's the same page as.
I don't think there's ever been, I, here, I mean, I'm trying to think, is there ever been I'm trying to think of.
What it entitled, what is that job description of a health officer?
It's in our state statute. I have to pull it up for you to get the specific. They basically is responsible for the dissemination of public health information and works with the county council disseminating the information to the public. You're not making medical decisions by any stretch.
Basically, it's what he's doing now. Move forward there, I don't hear any big major concerns with it, I don't know why there would be, because it's always been that for the past. Since I remember. Okay, entertaining topics for the next agenda by trustees. Limited to 3 topics. Anybody have any topics?
Two. Since chronic disease, communicable disease, is a hot topic right now, vaccines, environmental health. I would like to have our medical director, since he does specialize in chronic disease, I'd like to have him address the board about what we're doing back in our community.
I guess we can request him to come here. I don't know if we can,
I mean, he's signing all of our orders.
I understand that, but
Is he an expert though in that particular field?
And what? In what field?
Where you said he was
Yeah, he specializes in
communicable disease, you said.
chronic disease, yes,
Okay.
that is his specialty.
I will,
Yeah,
we'll reach out to him.
yeah,
I don't know if I can't command him to come here, but we'll sure reach out to him.
yeah, we are working on that right now to meet with him, with his schedule and see what we can set up.
Anything else?
I'll second.
Well, okay, thank you. Well,
It's his
I-
first and
I
second.
wouldn't.
Yeah, you have to put that on the
I
agenda.
was doing that okay.
I can't,
First and
I
second.
can't promise like for the June meeting,
Right.
I can't, but we're working to get that on there, so that's what,
In a future meeting that he can potentially be here, correct? We'll say that.
that's,
Yeah.
yeah.
Okay. Anyone else? All
Can I
right.
have questions on information? from-
Oh, I'm sorry. Yes, that was, I forgot you, someone forgot to remind me. There's information in the packet. You have questions.
I do, it's on the main room again.
Hold on a minute. You ready? No, I want to close this. There's no other questions or topics for the next agenda, correct? We're done with that. Okay. So this is an ad hoc one, but go ahead. You should do that.
So, on this meeting thing, I know I talked about it the last time, and
Which one we talked, which,
this was, this is scrap,
which slide?
this is scrap
Okay,
here.
The educational
The measles one?
resources.
Yeah, the measles education resources,
CDC.
so you see down here at the bottom left, it's from CDC government. So I'm assuming this was pulled from the CDC website, for that, okay. So when you go down to where it says measles can be serious, and it has 1 out of 5 people who get measles will be hospitalized. I couldn't find any research on that, but I'm assuming these 3 little icons here, the 1 to 3 out of 1,000 people with measles will die. Up until January, really February, the first death that they had in Texas, we've had 1 death of measles in 20+ years. So this information that we're putting out to the public, 1 to 3 out of 1,000 people with measles will die even with the best care, that is inaccurate. Unless we are only using the past 6 months and not the past 20 years. So we've already established and we've talked about, and I can show you the documentation of the 2 girls in Texas that did not die from measles. The second one was, she had bacterial pneumonia. The second one had a radical tonsillectomy and mono. They were recovering from measles. They did not die of measles.
so this document is put out by the CDC.
Yes, and you can go to
The
the
American
CDC
Academic-
website.
The
Yeah.
American Academic of Pediatrics, and the American Academic of Family Physicians. So I guess there's a question of what are they including
Well,
in the 1 to 3 with measles? Is the comorbidity, I know we're splitting hairs, I get it. But is a comorbidity situation? I don't know, I would have to, I guess we need to look at it deeper, but
well, you can look in the research and there's been 1 death that's documented everywhere, 1 death in 20 years of measles. This says 1 to 3 out of 1,000. Now, there's been 1,024 confirmed cases of measles 3 have died. And that's been in the past 4 months. If we're gonna use statistics for the past 4 months, I think that is shameful. That it's been 1 death in 20 years and we just happen to have. They're using those 2 girls in these statistics to scare people and they did not die from the measles. And it's documented, their records have been released.
Why do you think there was not a death in all those, what you said, 20 years? Why do you think there was not a death of measles in
There's
that
no
span?
document. There's only 1 documented.
In that 20-year span? You were
Before January, this January,
Okay, 20 years back, there was no deaths or?
1.
One, so we could contribute that to case studies that would contribute that to what factors that would not allow or not, people are not dying from the.
Because they don't die of measles. Maybe complication, like they're trying, like they're trying to say bacterial pneumonia, but she was recovering. You gotta look at the medical record.
Okay, gotcha.
There's 1 documented death in 20 years from measles. You can look it up. It's there. So then you go to this 1 in 5 people. 1 out of 5 people who get measles will be hospitalized. Well, you can't find any documentation from that unless you go back to January again, using these past couple months. 128 of the 1,024 were hospitalized. That's 13%. If it truly was 1 out of 5, 512 would have been hospitalized.
Well, I see what you're saying as far as.
Yeah, that's
as far as
20%.
the statistic on that.
13, yeah. And that's what I'm saying. These statistics are not correct. And I'm not saying we're muddying the waters. It's the CDC is muddying the waters. And that's who everybody trusts. I'm like, and that's why I have 0 accountability with me. So then let's go to 1 out of every 1,000 people with measles will develop brain swelling. You cannot find any information on encephalitis. Any studies or documentation of how many kids have been hospitalized with encephalitis. So when we go back to, if you look at the 3rd girl who dies that had the measles, the tonsillectomy, and I believe the measles came after this radical tonsillectomy and mono. It says she was unvaccinated. We go to the CDC website and they have these confirmed cases that were hospitalized in Texas, but 96% of the vaccine status is unknown of the 1,024. They know 1% had 1 MMR, 2% of the people had 2 MMR vaccines, but 96% of the people, they don't know the vaccine status. How can that be possible? The people that were hospitalized, they don't know the status. But the ones that they say died, they will absolutely throw in your face that they were unvaccinated. Well, 96% of the people we don't know. So how can you have these statistics?
Point taken.
Right. And that's all I have.
I really don't know how to address the CDC and
I know,
their
well,
lack
and
of
that's
that.
we're using them as a gold standard and we like bow down to everything they say that we can't make decisions on our own for the people in this county without the CDC giving us permission. And I'm not gonna sit around and let the CDC dictate my health. And I'm surely not gonna do it for the people in this county, and that's why I'm adamant about speaking out about it. Right here, you can see the discrepancies, and at face value, if you read it, you're gonna believe it. Until you start digging in, and believe me, I have dug into this, and I can prove everything I've said in documentation. So I just wanna put that out there that this is not, even though it's coming from the CDC, this is not accurate. And this is what we're scaring the people into thinking they're gonna die of the measles.
Any other comments?
So what sources do you feel we should be looking at as far as the data, the research?
Well,
going forward?
the one that, I was gonna comment about Lori, what she was saying, Ms. Boozle, was. I guess my question is, Mr. Chairman,
Yes.
who is responsible? Is it Steve or our medical director who, to be keeping up to date daily on the changes, like. The red dyes are coming out of the food and the toxic chemicals that we color our food with, cereals and things like that. The health department hasn't made any kind of public knowledge or notice to the people saying, hey. Now these dyes are coming out. You know, within the next year, I think they have to completely, you know, just like Europe doesn't have these dyes, they color their stuff with vegetables. Who's responsible? Like, did anybody watch the Senate hearing yesterday with all the FISA papers and what came out of that? Has anybody know about it?
I doubt they had time to watch Senate hearings.
Well, who should, somebody needs to be making time is my point, because that's where all this COVID. I mean,
Well, what do you, I mean, on the Senate hearing, what specifically are you talking about?
the Pfizer papers that were released of how toxic they knew that myocarditis was causing, or the vaccine was causing myocarditis in the young population of men. That's why for several months after the rollout, we saw athletes just dropping dead everywhere, all over the country, all over the world. And they have come out and it is in these papers. It's even printed in the New England Journal of Medicine. This research that they've come out with, like, who's staying on top of that? You know, that could be another 6 months before the CDC says something. Well, 6 months, we were still injecting young teens with the COVID vaccine. We should be letting the people know that, hey, this has come out. This is like legit, you can watch it.
I
I
think. we
mean,
have to
I'm
be careful.
AirPodding it all the time.
I think we have to be careful as a department as a whole, or a community, for what we put out there to the community, unless we really
You don't
know.
think the New England Journal of Medicine is
Oh,
legit?
hey, I agree with you. I think that they are, it's just that it's not officially been said to
Yeah,
the government that they're
It was
keeping all
yesterday.
these guys out.
it was
So
yesterday.
the companies that are making these products are okay with that? They're ready to take this big hit and loss and change all of that?
No, they
like
don't
that,
take a lot.
So I
No.
think we have to wait to see if the companies are gonna be on board with that, because it's still gonna be in.
Pfizer? You're gonna wait for Pfizer to
Well, not
decide whether
Pfizer,
they're
it's
gonna
just about
say
food dyes as
it's
well.
deadly?
We're talking
Well,
about
just-
food dyes as well.
I remind everybody, you know, by state regulations, CDC and the Department of Health and Senior Services and Department, State Health Department, we follow them. We follow their guidelines and what they point for us to do. It's state law, it's state regulation, so we cannot jump out here and.
I would see that, cause I know Florida's getting rid of fluoride without their health department. Utah's gotten rid of fluoride. Or Idaho, yeah, the Idaho.
We've,
There's other health departments making
we've
big
been
moves
through
on it.
this road again. I'll see if I can find all those things again as far as state regulations, what we can and can't do. I mean,
Is it funding we lose if we step out and start telling the communities, hey, can we not even say, hey, this is going on? This is what's
I
published,
don't
this
have a
is,
problem, I don't have a problem telling the public, but it needs to come from,
Trust the
a
source.
government trusted CDC source. Really is where it needs to come from, our Department of Health and Senior Services. I mean, I'm not sure the other regulatory agencies that we take guidance from. But it needs to come out from them, because, you know, you gotta be careful stepping out of that realm. And first person, and if I have another person tells me I need to go rogue, fine. You wanna sign off, if I'm gonna go rogue, you're gonna take care of my lawsuit, and you will sign off on that for me. Okay,
a lawsuit
because-
for
because
telling
I'll be
the
the guy-
community make their own
I'm not gonna
decisions.
I'm not gonna step out on a lawsuit where I'm the person making that decision. Okay, cause that's a lawsuit waiting to happen, if it's not the CDC, sue the CDC, sue the government.
Oh, there's plenty that have. And they're winning.
I mean, I'm not, stepping, I saw some information today, and I'm trying to put that calculation together, and it's kinda like. If the information's true, it's kinda like there's a lot of whining over a few things, so we'll see about that. but I'm not gonna step out and be rogue unless somebody wants to take and cover me and all my liability. Then I'll be more than happy to do that. I think it's a dangerous situation to get into. And if you don't think you can be held liable, you know, you can't.
But we're okay posting lies
I'm sorry, excuse me. Thank you. All right. Any other discussion points with inside the stuff that was laid out in our items that were given to us in the, I'm sorry? Yes, yeah, in the packet. I presume there is none. Now, let's see, next on the agenda is closed session. We don't have anything, so it'll be a quick closed session. Does just need to approve the the closed session minutes from last meeting. Does anybody want to make a motion going into closed session?
I make a motion.
Okay.
First and second, any discussion on the matter? And this will be in pursuant to 610.021, confidential and privileged communication between the Board of Trustees and Jersey County Health Department and its representatives and its attorneys. And records which are protected from disclosure by law. And really, it's just the closed session meeting minutes. So roll call, please.
Right. Mr. Pig,
Yes.
Thank you.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Gill,
I abstain.
Going into closed
It's
session.
roll call.
Going to closed session.
Taylor.
Yes.
All right. We will not be returning because